and this is a struggle. And so the use of Battelle and the recycling of these masks is so very, very important. And so I got off the phone a couple hours ago with the CEOs of many of our hospitals, but I want to make a public plea to them and to everybody in every hospital in the state of Ohio or any place where you are using personal protection equipment when you're using these masks. Every mask is precious. Do not throw one away. We now have the ability in Ohio to use that mask up to 20 times. And the way it works is they can be taken into Battelle, and Battelle will run those. And they basically mark on the mask how many times that mask has been run. So every time they mark it, change the number on that mask. So this is very, very important. And I would say to everyone who has these masks, it's important to recycle them. It's very, very important to do this. And when you do not do that, you are really denying somebody else a mask because we only have so many. And we are getting them in. We're trying to distribute them where it's appropriate, where the need is the most. But we are a long way from being able to give the appropriate protection to everyone out there that needs it. Our grocery workers and others, they need protection as well. So we are all in this together, and I just appeal again to our hospitals to send those masks to Battelle. Please, please take advantage of that. They can reach Battelle at battelle.org, BATTELLE.org. This is Child Abuse Prevention Month, and I'm wearing a blue tie, a plain blue tie, in honor of Child Prevention Month. Child Abuse Prevention Month reminds us of how precious children are, and it reminds us of how important it is that if we know or have any information about a child who is being abused, that we report that. This is a particularly difficult time because many times the people who report child abuse are what we call mandatory reporters. They're people who, by law, when they see an abuse, they report it. Some of the people who do the best reporting are our school teachers. And now, of course, with kids not in physical buildings, there's not the opportunity for the other eyes outside a home to look at that child. So I would ask everyone else to try to be more vigilant as we go through this period of time. The reports of child abuse are down. I think we can fairly say that that's not because child abuse is down. It is because we do not have enough eyes on these children. So if you're in a situation where you can see what's going on, we would ask you, please make sure you report this. You can call 855-OH-CHILD. That's 855-642-4453. 855-642-4453. Finally, let me thank our children's services workers. You're at the forefront. You're out there. You're making a difference. You do it 365 days a year. We are very, very grateful for what you do. Some happy news. I was on the phone last night when Fran and I were actually taking a walk on our farm with Tim Cook, CEO of Apple. And I just called him to thank him for a very, very valuable gift. And that is 100,000 of the N95 masks. So we will be getting those out to our frontline health workers. We thank Apple. We thank Tim Cook. Thank the entire Apple family. Those 100,000, I can guarantee you, will be well used here in the state of Ohio, and we are very, very grateful. I also want to thank Jobs Ohio and One Columbus for making the connection to Apple. Jobs Ohio is providing input as part of the PPE Alliance and assisting the state with rapid procurement requirements. We're very appreciative of them for doing that. Our goal each day is to do everything we can to protect our protectors, those folks who are out there at the front line making a difference. Let me now talk a little bit about the National Guard. As we've talked before, the National Guard is directly now involved in helping our food banks across the state of Ohio. They're helping to distribute food and supplies to families. These food banks heavily relied on volunteers. Many of these volunteers were older, and during this stay-at-home order, they certainly need the help. And so the National Guard has stepped up, and so we thank the members of the National Guard who are doing this. Members are also working with General Harris and Dr. Acton, helping to expand hospital capacity in our state. And we've talked about that the last 2 days, but the Guard is out there making sure that we have the space that we're going to need, the beds that we're going to need. Let me also thank the Guard, those members of the Guard who are supporting Ohio Emergency Management and the Ohio Department of Health to collect and take the inventory, store, and package the personal protection equipment for redistribution across the state. We're very grateful for all that they are doing. In the midst of the most challenging public health pandemic in over 100 years, it's more important than ever to celebrate public health. During the first full week of April each year, the American Public Health Association brings together communities across the United States to observe a National Public Health Week, a time to recognize the contributions of those who work in public health. This year marks the 25th anniversary of National Public Health Week. Right here in Ohio, as you've heard Dr. Acton say, and John and I say, there's 113 local public health departments who are doing amazing work. So we thank all of them, the members of the public health community, and we also thank everyone who's helping, who's at the front line in this battle. Our doctors, our nurses, our first responders, we thank you. Tina Husted, wife of our Lieutenant Governor, forwarded a video made by members of the Harmony Project here in Columbus, a music and volunteer community service organization. They wanted to share their thanks, and Eric will take a look at that video.
To all of our doctors, our nurses, our EMS workers, our physician's assistants, direct care providers, to all of you who are out there on the front lines, risking your lives to save our lives, thank you.
Thank you, thank you, thank you. I'm so proud and thankful for all that you're doing. And every morning in Tefillah, we think about you.
Thank you, thank you, thank you. You are sheroes and heroes.
Thank you so much.
My deepest gratitude. Thank you so much.
We offer you these virtual hugs as a reminder of the incredible gratitude we have for you.
Thank you for everything you do and for keeping our family safe.
From the bottom of our hearts, thank you.
I just want to say thank you to all of you who are out there on the front lines.
May peace and strength be with you. Thank you for everything that you're doing. Please know we love you. We appreciate you. We honor you. Thank you.
In this Together Ohio, we thank all of them. Very nice. Some other good news. Today I've asked the board, the Ohio Bureau of Workers' Compensation, BWC, to send up to $1.6 billion in dividends to Ohio employers and to send it this spring to ease the impact that the COVID-19 has had on our economy and our business community. We hope that we know that this will help. This dividend equals approximately 100% of the premiums employers paid in policy year 2018. BWC will apply the dividend to employers' outstanding balances first, including the recent installment deferrals. Any amounts exceeding outstanding balances will be sent to the employer. For those employers, it means one less bill to worry about. As in previous years, the dividend is possible due to strong investment returns on employers' premiums, a declining number of claims each year, and prudent fiscal management. It's also due to employers who work hard to improve workplace safety and reduce injury claims, and to the employees who do that as well. Even with the downturn in the market, BWC is able to provide this important dividend to employers while maintaining funds to take care of injured workers for years to come. If approved by the board of BWC, approximately $1.4 billion will go to private employers. Approximately $200 million will go to local government taxing districts. Checks will start going out later this month. As you may recall, a couple weeks ago, we announced a new campaign for Ohio, Find It Here, to support local restaurants and retailers during this time. Find It Here has been the kind of the slogan of our folks in tourism, but we want to utilize that in regard to our restaurants who are able to provide takeout. We continue to try to support them, and we thank them for what they do. Today we're launching a new video and new print ads to continue our efforts to support and showcase our local businesses. Let's take a look.
Always been a great place to live and work. And now, local businesses need our support more than ever. It's up to all of us to stay in, order out, shop local online, and keep Ohio strong. Because even though right now we have to keep our distance, in Ohio, we've never been closer.
Have carry out for dinner tonight. You can visit ohio.org/supportlocalohio to see the restaurants. Again, that's ohio.org/supportlocalohio to see the restaurants, the shops, and the virtual activities from across the state. Now I think Kim Hall is here. Kim will be coming up on the screen in a minute. Kim heads up Jobs and Family Services. She's going to give us a little update. It is a huge department that covers many things. So Kim, thank you for, there you are. Thanks for being with us, and give us a little report.
Thank you, Governor. Good afternoon, everyone. I too am wearing blue today, and I also want to acknowledge all of those who work in the children's services field, especially our caseworkers who are on the front lines of protecting Ohio's most vulnerable population. Thank you so much. The Department of Job and Family Services operates 8 statewide programs that impact the lives of millions of Ohioans every day. Our agency has always focused on providing opportunities and support for people in need, and now the 2,100 employees that make up the ODJFS team are diligently working to respond to the COVID-19 pandemic. As our challenges have multiplied, so have our efforts in key areas. In partnership with local agencies and other state offices, ODJFS is working to meet the needs of workers who have experienced sudden unemployment, businesses who are looking to hire, trying to avoid layoffs and planning for the future, parents who need continued support with childcare, and families who need help putting food on the table. I will provide a few updates on each of these areas during my time with you today. Please know that our top agency priority right now is our unemployment program. Since March 15th, hundreds of thousands of Ohioans have filed for unemployment. I want to say to every Ohioan that is unemployed, I know that you are experiencing tremendous pressure and anxiety about your situation. Adding to your difficulty is the fact that our system is overwhelmed by the unprecedented influx of claims, and it is moving much slower than it would under normal circumstances. You are the people I am thinking about every day as we work to meet your needs. I want everyone impacted to know that I understand, and my entire team understands, that you are proud, hardworking people who have done everything you can to be productive members of this economy and support your families. All eligible Ohioans will receive their unemployment benefits, and any delays in processing claims will not reduce the amount received. We have so far paid over $124 million to 195,000 Ohioans as a result of the COVID-19 pandemic. We are hiring more people, working longer hours, and adding more technological capacity so that we can serve you as quickly as possible. We have extended our call center to a 7-day-a-week operation, and by the end of this week, we will have close to 1,000 staff taking calls. Our planning is underway and moving rapidly to build the new system for self-employed claimants and other groups that the federal government has granted expanded eligibility. I am deeply grateful for the unwavering support of the governor, the lieutenant governor, and my cabinet colleagues as we aggressively pursue these solutions. For those Ohioans whose jobs have been impacted by this crisis, we understand that you have earned these benefits, and our team will not rest until you receive them. We know how hard businesses have been hit by COVID-19. The governor and lieutenant governor have addressed this issue every day. We have partnered with the Governor's Office of Workforce Transformation in the launch of a job search website, coronavirus.ohio.gov/job search, and it has postings for essential jobs that employers have open right now. There are also many Ohio businesses seeking alternatives to laying off employees. For those businesses, we've posted layoff aversion information on coronavirus.ohio.gov that outline programs like Shared Work Ohio that provide options for employers to explore prior to laying off their employees. ODJFS and local workforce areas are still providing employment services. Half of the state's Ohio Means Job Centers have remained open, and the others are providing assistance virtually to help job seekers with their unemployment needs. Additionally, the OhioMeansJobs.com website is still a great online resource to meet the needs of those who are looking to get hired at essential businesses or are taking this time to brush up on their skills. We know that childcare is a critical need in order for parents to work, and ODJFS is managing the pandemic childcare program for essential workers that the governor announced in March. More than 2,200 programs have been approved to operate since March 17th, and so far we have nearly 22,000 children enrolled. These programs are all required to meet basic health and safety standards while also limiting capacity to no more than 6 children in a space as we stay mindful of our social distancing guidelines. Nutrition assistance is another key ODJFS program that is critical at this time. As the governor shared yesterday, JFS will provide additional support to Ohioans enrolled in the SNAP program during the pandemic. Beginning this week, those who did not already receive the maximum monthly allotment for their household size in March will be issued an additional payment. Also, Ohio obtained federal approval to waive administrative verifications that are normally required at food banks, and this streamlines the process and limits person-to-person contact. Individuals may qualify for the SNAP program if their household's gross monthly income is at or under 130% of the federal poverty guidelines. To apply, please visit benefits.ohio.gov. We are glad to be able to offer this additional assistance and hope these measures will help families stretch their monthly food budgets as we weather this storm. I am so proud to work shoulder to shoulder with some of the most talented leaders in the nation at this moment in time. I know this is a difficult time, but ODJFS is here to present opportunities, and we will weather this storm together. Thank you, Governor, for the time.
Thanks, Director. Appreciate it. Thanks for joining us. Lieutenant Governor.
Thank you, Governor, and thank you, Director Hall. I know one thing that we all understand, that behind a statistic is a real person. It is a real person who, for example, if you're attempting to get unemployment benefits, who has needs, who has concerns and fears in life, and we understand how important it is, and I know the Director and her team are working very hard to provide all the services that they do at the Department of Job and Family Services here in the state of Ohio. Pivoting from that, I know that there is a great irony that also exists in our economy right now, because at coronavirus.ohio.gov/job search, there are now 33,641 jobs that are available from 478 employers. Now we need to understand what's behind this. We have screened this system. This system only includes businesses that we know are not just essential, but critical to the supply chain of serving you during this difficult time. Anything from healthcare to manufacturing that maybe is ramping up to make some of the PPEs and critical equipment, to the food supply chain. All of this is incredibly important, and there are over 33,000 jobs available right now. So if you are in a position that you can fill one of those jobs, or you know somebody who can, please send them to the job search portion of the coronavirus.ohio.gov website. And I know that one of the questions that I get and the governor gets all the time are from people who are wondering, when will things get back to normal, and what will that be based on? This is a question that we wrestle with constantly. It's a complicated answer. There's no doubt about it. And I first want to start with the good news. The good news is that thanks to the wisdom and decisive action of the governor, Governor DeWine, Ohio's in a much better place today than we thought it would be. We have not experienced the catastrophic scenarios that we surely would have if those actions hadn't taken place. So that's the good news. And it's not only the governor's actions, more importantly, it's your actions in response to what he asked you to do, which was the social distancing, the hygiene habits, and all that comes along with trying to make sure that we slow the spread. And that's the good news, because collectively, we as a state have saved a lot of lives and avoided the catastrophic scenarios that we surely would have experienced without those actions taking place. Now, the bad news. The bad news is that we are still deep in the midst of a health crisis. In a few moments, Dr. Acton's going to give you the statistics of what happened overnight. More people went to the hospital, more people died than the day before. And those aren't models, those are real people. Those are people with families, people with loved ones, and we deeply, deeply care about what happens to them, and that we know that we are still in a battle that has to be won. And that's the bad news. But another consideration also as you look at this is something the governor touched on earlier, which is the existence of PPE. We don't have enough yet. We have to conserve what we have, because there are many people out there on the front lines who need it and deserve it. And we can't open things up and put more people in jeopardy until we have the protective equipment that will give them a sense of comfort and a sense of protection that they really deserve as they're out there working and trying to serve all of us. And we're working hard at it. We're trying to build the capacity in Ohio from our manufacturers. We're trying to acquire it wherever we can. You know, they're really the big pieces, and it's really trying to find that balance, the balance to execute the Ohio strategy. And I know that as we continue to do this, that we're going to be better off. So in digging into this, you know, we ask ourselves, well, what might that future look like? What could that future look like in Ohio? Governor announced a team of people from the private sector that are working on this. We have a staff of people in the health that are working on the health aspect of this, consulting medical professionals. We're not doing this in isolation. We are asking people who know, who are professionals, who are experts at this, you know, what is it that we need to do to help? And so life won't exactly go back to what it was like pre-coronavirus. There will be a lot of thoughtful decisions that need to be made to make sure that as we emerge from the first surge, that we don't create a second surge of spread. A vaccine would be a game changer. We would love it if there was a vaccine. That would solve so many problems, wouldn't it, Dr. Acton? But it's not likely that we're going to have that for a year or longer. And one of the people who I think we all in this room respect, and I think the nation respects, Dr. Anthony Fauci, said it like this: it's not like a light switch, on and off. It's a gradual pulling back on certain of the restrictions as we try to get society a bit back to normal. And Dr. Fauci continued that the first condition is a steep drop in the number of cases, which we haven't seen yet in the actual number of cases. And you've got to make sure you are absolutely going in the right direction. And then he said, you gradually come back. You don't jump into this with both feet. And that was the advice of Dr. Fauci. So what does this look like? Like, what can you, I imagine if I'm out there and I'm trying to think, how do I prepare for this? What does it look like? And it looks like it's pretty much common sense as we go through these things, but I'm going to give you a few examples that have been deployed around the world and that people who are working on this are going to suggest. First of all, the emphasis on hygiene, even when that day comes that we relieve the restrictions, does not go away. It's not going to go away. Hand washing, sanitizers, these are still going to be part of our lives. Masks will become more common and should be to control the spread. Gloves too. And as I have to smile a little bit, don't be offended if you don't get handshakes or hugs for quite a while. We're going to have to change the way that we interact as long as this is a threat in our lives. Testing, we need more of it. Testing is critical to finding our way out of this. More tests determine who's carrying the virus, and then the antibody testing that we've been working on is very important because we'll know once we have that who has the defense. And who is going to be better able to do some of the frontline work that we need to have happen. And there's also a lot of talk, this is something that many states are working on, a lot of talk about effective supplemental tools to track the symptoms data and to know who you may have come in contact with who had the disease or where people are who have the immunity. Crowds in crowded areas will be bad for a while. This is not something that we're going to flip a switch on for sure. This is what all the studies have shown, how difficult that is. So if you think about this as an employer, that's your workspace configuration and common area configurations. However you're looking at it, we're not going to allow, we're not going to want people to congregate, even when we begin to restart some of these things. That might mean more space between tables, staggered seating, limiting congestion in crowded spaces, appointment-only access, checking temperatures if you can, particularly if you have a lot of people who are interacting in a space. You don't want to have the spread. A dedicated cleaning staff and common spaces and entryways. These are just some of the elements that businesses and people around the world who've experienced this have employed to slow the spread or to stop it from reemerging as a threat as they begin to resume normal life. And if it can be done safely with hygiene and social distancing, then those are the things that come back first. If it can't, those are the things that will follow later on. And vulnerable populations, they're going to have to continue to take care of themselves and take these precautions. These are all the things that are emerging on these lists of how we reemerge. And these are the kinds of things that the governor will have to take into consideration along with the health data as we begin to think about what restart looks like. And I guess I want to close with something that I read yesterday from one of President Trump's economic advisors, Larry Kudlow. And what he said is that it's the health people that are going to drive the medical-related decisions. But I still believe, hopefully, and maybe prayerfully, that in the next 4 to 8 weeks, we will be able to reopen the economy and that the power of the virus will be substantially reduced and we will be able to flatten the curve. And so I guess as we enter Passover and Easter, the Easter Holy Week, amen to that. Let's hope that we are able to restart this as soon as possible, but you now have hopefully a better understanding of the factors that go in and why Ohio is well positioned, but why Ohio still has work to do. So thank you, Governor.
Lieutenant Governor. Dr. Acton.
Okay. Good afternoon, everyone. Let's get started with our slides. So today we have 5,148 cases as of this morning. That number continues to rise. We now are seeing cases in 83 of our 88 counties. And unfortunately, you know, the death numbers are climbing in Ohio. We are at 193, approaching the 200 mark. And as the governor and lieutenant governor said, you know, Mr. Dawson, and every single one of those numbers is a story unto themselves. And so, you know, we talk a lot about numbers here, and I always feel strange saying them because they're people, and they're people with stories. And we're going to tell more of those stories in the days to come, and our thoughts are with you on that. Next slide, Eva. So we're still seeing a median age of illness at 54. Our age range still less than a year age to 101. We have now tested 53,000 folks. Hospitalizations, to date, almost 1,500 hospitalizations, and ICU admissions at about 472 right now. And these weeks that you have created have given our hospitals and our healthcare system really time to structure and be ready. We still are experiencing, again, shortages of testing, plague us, and shortages of PPE, as the governor said. So the actions you're taking and keeping the pressure off our healthcare system are vital, because otherwise they wouldn't be able to provide that care for emergencies like our heart attacks and our strokes and car accidents and births. So the work you're doing in staying at home has been saving lives, and let me show you a little more about that. So the good news, and I know there's a lot being said about modeling. Again, the weather prediction models that will continue to change and ebb and flow. All the decisions we made, you know, were based on the reality of a once-in-a-lifetime pandemic and sort of what we were seeing both clinically and what we knew works to slow down a disease for which there is no cure yet, for which everyone in the entire world was susceptible. So these models, I want to tell you more about them, but the most important punchline is this. Every single modeler, everyone who talks about it, is saying that we must keep doing what we're doing. We must, you're succeeding, but the second you ease back, we'll see ourselves in an outbreak that will really overwhelm our healthcare system. I think even the most conservative numbers of making sure we're prepared for worst case scenarios, to the folks who have said, you know, we're doing so well, you know, we might not run out of ventilators, which is our whole goal all along, is to not run out of that precious equipment, not be forced into difficult decisions. They are saying, Dr. Murray at the Institute for Health Metrics is trying to say to you, don't stop doing what you're doing. That's what these models are showing. And I want to talk about one piece of this because it's going to be important. We were one of the first in Ohio with these aggressive, bold moves. We want to be one of the first states out. But we're going to need to follow the modeling to get there. We're going to need to follow our testing results once we have them. And it's going to be based on this sort of premise of modeling. So we've tried to break it down for you here. It's all based on susceptible people. It's called SIR modeling. Susceptible, infected, and who's recovered. And this is really back to how infectious is this disease, how quickly does it double. We want to see that doubling time get much, much, much longer. We've been seeing doubling times in the United States of 3 days to 6 days. We want to get that out to 12 days and farther before we can even begin to slow down that gas. But it's all based on how this spreads. Next slide. So this is us in Ohio. This is us before, and we know now that this disease was seeding and spreading even before you ever met me. But, you know, this is the population of Ohio waiting for a new novel coronavirus to enter. And eventually we started being seeded, and this was early on, even before we started making some of the moves, even before the Arnold Classic. We had travelers going back and forth. We took very aggressive measures to quarantine the people we know of, but we now know, and it's been publicized, that many, many people came back from places that were endemic with the virus and brought it back all over this country, and it was seeding in our country. And so those first cases landed, and then they were often, some were known, but many weren't, starting to spread the disease. And so one infected person does that Kevin Bacon degrees of infecting 2.5 to 3 people in their sphere of influence, and then those go, and that's where we get that logarithmic spread of the disease. That's what we didn't want. We didn't want to be Wuhan, where they just went straight up that curve. We wanted to slow down that spread. Keep going. So that goes more and more. So the people who are infected keep spreading. But somewhere in here, we start to get the blue dots, and those are so important, and that is going to be important for our recovery. These are the people who are now recovered. So we have our susceptible people, the orange, the people who are infected, red, spreading, but then eventually we get those people who are recovered. And they are the people we're going to be detecting through our antibodies. They are going to be part of our recovery plan. They're also part of the people who can donate some of their plasma so that we can use antibodies as a form of treatment. So the blues growing is how we are going to eventually track this. Keep going. So before, in our earlier modeling, we knew all along that if you did nothing, we would have predicted 62,000 cases per day at the peak. And of course, we would have peaked long ago. In Ohio, if we were predicting up to initial peak projection on one modeling was 98,000 cases per day. We had another model that said 6,000 to 8,000. Our latest projection is 1,600 cases per day. Still a lot of cases per day, still a load on our hospitals, but this is the effect you have done. And watch this. In Ohio, we took our prediction, and you have basically done this. Ibo's doing our little, Governor, I don't know if you can see it, but you have squashed this and you have stretched it. Honestly, this is you. This is what you have done. This is how you have saved lives. But please know that our data, the reason the modeling takes a while is it took about 2 weeks to see the effects of the strict social distancing. And if we stopped today, if we all ran outside in 2 more weeks, we would have gone way back up again. So that's the thing here. We've got to hold steady, hold the course. Next slide. So this is another way to look at it, and this is a little more of the story of what Ohio did. We did early mitigation. Some people came in a little bit later. And you see then that they're worse off on the numbers at their peak. Later and later in mitigation, this would have been no mitigation. And we'll have this on our website because I'm sure it's very hard to see on your screen. But we're very blessed to be in this category of the early mitigation, and we got to stay there. Thank you, Ibo. Next slide. So a couple things I want to say to you. First of all, if there ever has been a time that we have to realize how interdependent we all are on each other, the One Health concept, the worldwide concept, this is it. There's no way out of this without what we are going to do together. And what we do in our state and what we do across this country is really going to affect each other. We will be talking more and more, just like Dr. Boutros said on a hospital call I was on earlier today with all the hospital CEOs. What this has done, what you have bought for our hospitals, is a way to start shifting. We don't have to build out quite as big, hopefully, if our behavior stays the same, in some of our big centers, the way you've seen tents or doing in our convention centers. We're still poised because this disease is stealth, and we don't know where it will take us next. So we have that ability to build out large facilities now. But the other thing we've been building is the ability to be mobile and agile and flexible in our response. So we now know that there are going to be hotspots like our prisons, like our nursing homes. And what we are doing is taking not only this, how we build out very static structures, we, in a partnership with the state and local, are being able to move things quickly. So if we see a prison that is running out of PPE, we can get that there. If we see a small hospital that needs more ventilators, we're actually going mobile. And our best experts are coming alongside each incident, each flare-up, and just crushing it. And that is a big part of how we are going to get out of this early. I also want to say a couple other things. First of all, in addition to being a blended family, we are also a religiously blended family. Hag Sameach to all my friends. I am Jewish. Even my background was a mixed background growing up, and my children were raised in the Jewish faith. My husband's children are Episcopal, and they were raised in that. And we were both celebrating all those holidays together, and of course, we're celebrating those in new ways. It is vital, and I pray and ask of our religious leaders in the state. One of the worst things we can do is congregate in any way that puts our population at risk. We are doing a virtual Seder tonight in my family. My friends dropped off. I couldn't cook. They've dropped off the foods that I love, and I love to cook. That's another thing I haven't shared. My matzo ball soup is the best, just saying. But you know, my friends cooked for me. They dropped it off on my doorstep, and we're going to be together talking about the story of the plagues, of which have a very poignant meaning as we go through what we're going through. These diseases have been around forever. And, but also as we celebrate Easter, and please, 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 please do this in a way that keeps us all safe this year. And I feel that we will all be closer than ever. And lastly, I want to say that I am wearing blue as somebody who experienced child abuse. I've always been so grateful to our governor from the very beginning of his career that has fought against helping kids who don't have a voice and who often go hidden. Please keep using those hotlines if you see something, whether it's domestic violence or child abuse. This is Public Health Week. It's only been, for me, a little bit over a year since I came to this position. One of the first things we did, so this is to my staff and my team and all the local public health people on the front line. This is something I did with my students in class. Public health is that secret thing you never see until you need it. Unfortunately, what I fear could happen in this outbreak is that once again, we've had a huge, and we're in the middle of it, public health victory in shutting this disease down and slowing its spread. The fear I have is that whenever we have these silent victories, people say, well, it was never there to begin with. There was no threat because we've won this public health battle. Please, 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 this battle is ongoing. And this is to all my friends out there on the front lines, risking their lives every day, doing these contact investigations. You are public health, and we support you forever. And with that, I give it back to our governor. Thank you.
Dr. Acton, thank you very much. We'll open it up for questions.